Hi, before I start my presentation, I'll be showing my flashcards. Imagine going to sleep one night and then waking up with a permanent room and you have no idea what's going on. And having to go to the ambulance to go to the ER and then finding out that you just had a seizure. This happened to me in 2013 and it was one of the scariest moments of my life. But this didn't just happen to me, this happened to many other people. According to Healthline, about 150,000 Americans get diagnosed with epilepsy every single year. My goal is to inform people on what is epilepsy, and I will be discussing what is epilepsy, signs and symptoms, and also treatments that are available for people who have epilepsy. So now let's talk, what is epilepsy? Epilepsy is a neurological disorder that causes seizures. According to Epilepsy Foundation, there are three types of seizures. So in general, there's really two. There is the focal seizures and the generalized seizures. But the third one is the unknown seizures, which happens when there's no witnesses to when someone had a seizure without no witnesses, like no one saw it. So the focal seizures, it only impacts a certain part, while the generalized impacts more parts of the brain. So focal seizures are two types of seizures that go underneath this would be focal aware seizures and focal impaired awareness seizures. So focal aware seizures are when they're aware and they know that they're having a seizure. And while focal impaired is they're not as aware, they're confused on what's going on. Um, Also, focal aware seizures are also known as simple partial seizures, and focal impaired awareness was also known as complex partial seizures. So now going on to generalized seizures, there are six seizures that go underneath. It is absence, atonic, tonic, myoclonic, clonic, and tonic-clonic. So absence seizures is the most common, and it's when someone zones out for a certain amount of time, usually like 10 seconds. And then you have tonic seizures. Tonic seizures happen when someone's asleep, and it usually happens for like 20 seconds. Usually when someone wakes up, they're not aware that they have a seizure. And then you have atonic seizures, which is known as a drop seizure. So they'll randomly drop on the floor and have a seizure. It's very harmful because many people have been injured because their head hit glass, they had hit a hard ground, and they get injured, they get injuries. And then you have the myoclonic seizures. Myoclonic is a brief jerking of the arms or legs. And then you have the clonic seizures, which is the repeated jerking of the arm and leg. And then you have the tonic clonic seizures, which is the repeated jerking of the arms or legs, but also the muscles tend to stiffen after. So now let's discuss signs and symptoms of epilepsy. According to Mayo Clinic, the symptoms for epilepsy are temporary confusion, staring spell, uncontrollable jerking movements of arms or legs, loss of consciousness or awareness, and there's also psychological symptoms like fear, anxiety, and deja vu. So people typically experience deja vu when they are reliving the symptoms. So they feel an episode is going to occur, which is cause fear, anxiety, um, and then for temporary confusion, they it means when they don't know where they are, or sometimes they don't know who they are. So after a seizure, they tend to ask the person for their name and where they are, just to know that they're okay. And now let's discuss treatment plans. So the most popular is medications. there's anti-epileptic, and then there's also medical marijuana. And then there's also surgery, which is epilepsy surgery, where the surgeon removes part of the brain that causes seizures. And then you have a diet, which is keto. Um, Many people use anti-epileptic medication, but if that doesn't work, they'll go to medical marijuana if traditional therapies didn't work for them. Um, Keto is mostly offered to children, and anti-epileptic helps children prevent getting seizures when they're older, which it does work for many people, but in some cases it does not work. So that's why they have medical marijuana or they'll get the surgery. Um, the reason why I chose this topic is because it was very personal to me. I have epilepsy, so I know a lot about this topic, and I wanted to inform other people on what is it, and um, I hope you know more on the types of seizures that are happening. Also, I hope you know signs and symptoms and treatment plans that are offered. And for my quote, I chose, "Where there is hope, there is faith. Where there is faith, miracles happen." Um, I'm not sure who this is by, but this quote has helped me a lot. Uh, I having epilepsy as it made me a bit hopeless. So this quote did help me a lot, and it just motivates me, and it it's an inspiration as well. And I always look up to it when I'm down, and it helps me, especially like after a seizure. Um, and after a seizure of having like months without seizure, and then I have one, and I see this quote, it helps me not give up hope. And thank you for watching my presentation. And yeah.